Hi, my name is Jordan Joyner. I'm a third-year PhD student at the University of North Carolina at Chapel Hill and a member of the Paul Dayton Research Group. Today, I'll be talking about using therapeutic focused ultrasound, or FUS, as a treatment for pancreatic cancer. Pancreatic cancer is a devastating diagnosis because it's usually caught at late stage when surgery is not possible, leaving chemotherapy and radiation as the traditional course of treatment. These tumors recruit many different types of cells that make it a site of immune privilege and develop resistance to drugs. There's also a physical barrier made of extracellular matrix proteins, called the stroma, that blocks healthy immune cells and drugs. So our hypothesis is, can we use therapeutic ultrasound to remove these barriers to drug delivery and recruit immune cells to pancreatic tumors? We can leverage FUS protocols to activate the immune system by inducing damage, which will cause the tumor cells to release tumor-specific antigens that can be sensed by local dendritic cells that travel to the lymph node to recruit and activate T cells. Since there are several biological processes needed to induce a lasting immune response, it's unlikely that FUS alone will achieve these lasting anti-tumor effects. We want to combine FUS with immunotherapy to boost and sustain biological responses. There's a wide array of FUS parameters that have been demonstrated to cause immune and biological effects, and in the study, we explore the effects of non-ablative mechanical FUS on pancreatic tumor cells. These protocols cause gentle mechanical effects with the help of stable microbubble cavitation, and no heat is induced. Before we can combine FUS with immunotherapy, we need to determine the immune effects of FUS alone. With this study, we wanted to determine which immunotherapy should be combined and what the treatment schedule should be. Our FUS parameters involve a constant infusion of lipid-shelled microbubbles, while raster scanning the FUS transducer using low pressure and duty cycle along a grid to treat the entire tumor. We treated for 2 seconds per spot, which equated to a total time of 5 to 10 minutes, depending on the tumor size. The study design is shown here. We gave mice subcutaneous KPC pancreatic tumors treated with FUS and microbubbles or no treatment and sacrificed either 2 days or 15 days post-treatment in order to determine the short-term and long-term immune effects. We performed flow cytometry on tumors and lymph nodes to assess cell populations and histology to assess tumor damage and T cell infiltration. With flow cytometry, we saw the most significant infiltration of immune cells in the lymph node 2 days post-ultrasound treatment, including activated dendritic cells, macrophages, and CD8-positive T cells. These effects subsided after 2 weeks. Based on these results, in the future, we're planning to dose immunotherapy 2 days post-FUS treatment, and our immunotherapy of choice will likely be an antibody that can boost dendritic cell recruitment of T cells. In these histology graphs, we have stained tumors red for HMGB1, which is an inflammatory protein that's released from the cell nucleus to the cytoplasm when the cell is damaged. Here you can see a visual and quantitative increase 2 days post-treatment. And finally, although tumor growth was not expected to be affected with FUS alone, we did see slight tumor growth suppression from treatment to 15 days after, which is promising for future studies where the outcome is survival. In conclusion, low-intensity FUS and microbubbles cause the release of tumor damage signals, recruit dendritic cells, macrophages, and CD8 T cells 2 days post-treatment and may cause tumor growth suppression. The immune effects subsided 15 days post-treatment, demonstrating the need for immunotherapy and/or multiple treatments. In the future, we will combine ultrasound with immunotherapy that helps activate T cells and use an image-guided therapy system to treat orthotopic tumors for increased clinical relevance. Thanks for your attention, and I'm happy to answer any questions.